suggest cases could peak at 2,500.
Well, there's been modelling put on the public data, which has many ranges, and we've. I can't. I've seen various versions of modelling, and I can't recall what all the numbers are. But I can tell you this much: that we know that the rate of hospitalisation is likely to peak sometime in October. We know there's ranges of predictions on what the case numbers will come up to. I've often said, as Dr. Chant and Dr. Gall and others have said, we anticipate the worst will be in the next couple of weeks in terms of case numbers, and that is because the worst will be in the next couple of weeks, because the impact of the vaccinations takes about 2 or 3 weeks. And as we've said from the outset, lockdowns work in suppressing the spread of the virus, but the best antidote, the best weapon in fighting the virus is the vaccine. And once we know someone is vaccinated, it takes effect in 2 or 3 weeks' time. And we know there's been a high concentration of vaccines administered in the last week and the upcoming 2 weeks. So it follows suit that we still anticipate case numbers to rise in the next couple of weeks, and then we anticipate and hope that they will start to come down. Ursula's turn, sorry. I'm sorry, it's Ursula's turn, yep.
Well, I do have a question, but I will actually just let Alex finish that.
Okay, sure.
Follow up there. You can't recall what the worst case scenario peak that you've been presented with is.
Well, no, I'm saying there's various modelling that is done. New South Wales Health provides us with modelling, but there's also modelling done by external organisations, which New South Wales Health isn't part of. And those external organisations, as we've all publicly read, have varying degrees.
What's advice to you from New South Wales Health? The worst case scenario they presented to you, you don't recall what that is.
Look, the worst case scenario varies, and it varies, and it depends on what the inputs might be. And I wish I had a crystal ball to be able to tell you. What I can tell you, the most recent advice that I have received is that case numbers are likely to continue to rise for the next few weeks, and the worst hospitalisation rate is likely to be in October. And I can't tell you any more than that, because that is the best advice that I have.
Just on those restrictions, so everything is on the table at 70%. Stadiums open, you said this morning on Sunrise, so stadiums will be open, home visits are on the table, cinemas are on the table.
Well, obviously, things like, as I said, high risk issues like home visits is what the greatest risk is. And what is key is for us to be able to demonstrate that people are vaccinated. So when you have a controlled environment, like a venue or an outdoor event that's ticketed, you can actually control that only vaccinated people come through. And that is the key. The 70% freedoms relate directly to full vaccination. And that is why it is key for us to be able to demonstrate that people are fully vaccinated when they're attending an event or attending a venue. And clearly, for all of us, indoor is more high risk than outdoor. But having said that, controlled, regulated environments are safer than uncontrolled environments like homes. So it would be far safer, for example, for a family to have a meal in a restaurant than it would be necessarily to have people come into their home that may or may not be vaccinated. So the key to freedoms is the full vaccination, is someone being fully vaccinated and being able to demonstrate that. And that is what we're basing our roadmap on, and that is what we'll obviously convey to the community as soon as we finalise those plans. And I'm hoping it won't be too long before we can do that, but it will reflect very closely the national plan that the Prime Minister and all the state leaders have been discussing. So it won't diverge from the national plan, but it will be our commitment to stay true to that. Clearly, for example, in some states, they may have 2 square metre rules depending on their number of cases. In New South Wales, we might start with 4 square metre rules. So I put that on the table, that they're the type of issues that we'll consider closer to that time, and obviously with the best health advice. And similar to our plan for schools, that we obviously took the health advice, took education advice, and then made decisions. And this will be a similar approach. Stakeholders are coming forward with their suggestions, and the health advice is critical. But every state can assess its own risk at 70% double dose, and I'm sure some states will continue the way they are, but states like New South Wales and Victoria will need to look more closely at what the case numbers are doing at that time. And I anticipate density may be, for example, an issue which differs from state to 70%, but I'd much rather know that I can go to a venue and have a meal or have a drink or get a service that I can't get now than not. And that's the strong message we want to send to the community.